Senator Price.
Thank you, Dan, and thank you for the hospitality here at USC. I'm State Senator Curran Price. I have the honor of representing you in the 26th Senate District, which includes portions, well, it includes all of USC and portions of the 9th District as well. When I'm here, I'm really excited to be here because this is really what community involvement, community engagement is about. We're blessed to have a number of very exciting speakers, panelists you're going to hear from. Very proud that our friend Charles Ogletree could come out and join us. We're going to be hearing from him. And let me just also acknowledge a real mentor in our legal community, Attorney Leo Bratton. Where's Leo? He's still there. He is in the back. Leo Bratton, civil rights icon in jurisprudence. But I'm excited to join you today, not just as your senator, but as a prospective member of the City Council. The issues we've been fighting with, first in Inglewood and then in Sacramento in the Assembly and now in the Senate, have been basic: education, economic development, jobs, housing, the kinds of issues that really impact this district. And so while I certainly am proud that the 9th includes all of LA Live and all of USC, they can take care of themselves. I'm going to assist all I can, but I'm really going to be working for the people in the community, those that are concerned about not having a job, those who are concerned about having substandard housing, those that feel that their schools are not meeting their needs. And I'm convinced that we can have a new spirit of cooperation, new spirit of enthusiasm. And it's exemplified, I think, by this panel discussion that we're going to have today. Talking about issues, talking about solutions, and hearing from individuals who have been actively engaged in trying to build bridges, find solutions. And that includes your input in your discussion. And so I think it's important and significant that we're meeting here at SC, that SC is hosting this. But it's even more significant that you are here from, as I understand, up and down the state, not just here in the LA area, but we got some friends up from San Diego. So we want to extend welcomes to you, let you know that we appreciate your presence, your involvement, that as an elected official, my commitment is to serve you. I've done that in the past, I'm doing that now, and I will do that in the future. And so I look forward to an opportunity to discuss the platform in some detail. We are all, as I said, excited, committed, and firmly routed in making sure that we make this community the best possible. And we look forward to an exciting afternoon discussion.
My great privilege here at the University of Southern California is to run our Institute of Politics. And my job in that role is to get our young people, to get our students more interested, more involved, more engaged, and more motivated in politics. And what I try to explain to them is politics isn't just two old guys running nasty TV commercials against each other. Politics is campaigning. Politics is government. Politics is volunteering. Politics is issue advocacy. Politics is doing anything you can to make your community a better place to live. So in today's room, there are not just 4 politicians. By my count, there's about 100. And so once again, give yourselves a round of applause for giving up yourselves to make your community a better place to live. One thing we do here, in addition to our work with students, is we do public opinion research. And we research voter attitudes in Los Angeles and around the state of California. And throughout this last difficult, wrenching recession, we have surveyed the attitudes of California voters, not just on which candidates to support and not just which issues to support and to oppose, but rather to get their sense of themselves as a community and as a state. We asked people how they had suffered during this recent recession. We asked them if they had lost a job or knew someone, or had a family member who lost a job, who'd had their hours at work reduced, who'd put off the purchase of a car or a major appliance, who'd fallen behind on their mortgage payments. And then we asked Californians how optimistic or pessimistic were they about the state's future and about their own. And very briefly, I want to tell you what we found in those poll results. We found, and it should come as no surprise to anyone in this room or anyone who pays any attention to life in these United States in the 21st century, that those voters who were most adversely impacted by this recent recession were young Californians. We're African American Californians. We're Hispanic American Californians, were Asian American Californians. Overwhelmingly, by every measure, these are the communities that are most adversely affected by this recession. But then we saw a funny thing. I want to say a funny thing, an interesting thing, in fact, an inspiring thing. That the same communities, the same voters who were most adversely affected by this economic downturn were the most optimistic. Not only about their futures, but about their communities' futures and about their state's future. And this is a reminder to us, as older people, and it's a good lesson for our students, our younger people, that the people who rebuild the community, the people who rebuild the state, the people who rebuild the country, are the people who have suffered most adversely in the past, and who lift themselves up and come back and work and work and work until something better, until they make a better future for themselves and their families and their communities. There is no one in the United States of America I know who is a better and a more eloquent voice for those young Americans, for those dispossessed Americans, and for those newly empowered and re-empowered Californians than our guest of honor today. 14 years ago, I was in Cambridge, Massachusetts, and I had the great privilege of sitting in on a class taught by Professor Charles Ogletree. And for those of you who have not heard him speak in the past, I will tell you that that hour of my life was transformative. We are, as several of our speakers have already noted today, we're going to have a series of community discussions today. Panel discussions on healthcare, on business, on education, and on the prices of the lack of education. But before we get to those broader discussions, and before we open this discussion to all of the eloquent voices in this room, join me in welcoming the most eloquent voice in this room, one of the most eloquent and most passionate voices in the country. It's our great honor to host Professor Dr. Charles Ogletree.
Thank you all, my Los Angeles family. It's nice being in Los Angeles again, and I want to thank first the person who made all this possible. Always sitting in the back, always quiet about it, but we wouldn't be here if not for Frank Jordan. Thank Frank Jordan for making all this happen. And I see some of my homies here, the folks who've been involved in the reparations movement as long as I have been involved in it, and I see them. Queen Mother Bell, where is she? Right. Mr. Peoples is here somewhere with this wonderful new, Mr. Peoples? Yeah, there you go. Right. And Big Money Griff. Where's Big Money Griff? These are legends here in California. They've been leading the movement for a very long time. And I'm very pleased to introduce a very dear friend of mine. And most people don't realize how phenomenal this lawyer was, is, and should be recognized for. He was one of the 4 lawyers who I met as a student at Stanford in the early 1970s, because they all volunteered to be lawyers for Angela Davis, African-American woman, an avowed communist, who was charged with conspiracy to commit murder and was acquitted of all those crimes. The reparation folks know that we were in San Jose. We were ready. We had plans. We didn't think she was going to be acquitted. We had to change our plans. So none of us got locked up, let me put it that way. But the lawyer who made it happen, who was a lawyer for the members of the Communist Party, he and his brother were just phenomenal lawyers, and he made a big difference in the justice system in the 20th century, and he continues to do that. Please welcome here Leo Branton, if he will be recognized and be acknowledged. This is a very challenging time to do all of these things in the short time that we have. And before I introduce the panels, let me just say a quick word of the privilege of being here. Everybody knows a little bit about Charles Ogletree, Stanford graduate, Harvard Law School graduate, Harvard Law School professor. But there's a lot before that, and I think people need to lift up who they are and where they've come from. And I am a native of the farm community of Merced, California. That's where I grew up. I went to public schools there. My mother's from Little Rock, Arkansas, but didn't finish high school. My father's from Birmingham, Alabama, didn't finish high school, but made sure that their children understood that if they're going to make it to the next century, they have to be involved in education and have to understand that. And we're big supporters, and I think that makes an enormous amount of difference. And so I hope you see me not as someone who's a tenured professor at Harvard, but as a kid with the faith of God, grew out of poverty and out of the challenges of the 20th century, And I'm here now, opening up doors and lifting up folks who are behind me to make sure that they can be involved as well. Let me introduce two of my relatives who are here. They didn't expect me to call on them or introduce them, so I'm introducing them so I won't call on them. You got that, Michelle? Galen is somewhere. Galen Burson was a highway patrol for 3 decades here in California. And he's retired now, and he's my security guard. So if y'all try to impress me, you know, Galen's ready, he's ready. And my little darling, who has been, since she was a baby, here in California, has been a big supporter. Michelle's here with her friend. Please welcome Michelle. Michelle, stand up so they can see the grown Michelle. What we're going to try to do in this first panel is to try to talk about healthcare and what it means. And the thing about it, it's a very, Frank does these things. So he says 20 minutes for the panel and 10 minutes for the responses. So I know Brother Peoples has a long question, but whatever it is on healthcare, the best questions are 8 words or less. So I'm giving you 20 minutes to think about what you want to say, Big Money Gruff, just so you can be prepared for what happens, Queen Mother Bell. I'm not calling anybody out particularly, but people to think about what their answers might be as we go through. Did I just call out some people? You know I don't do that. But I've got some wonderful people about healthcare. And this is not the only session. We're going to have a lot more. Frank has already told me he wants me to come back, and I will come back. And I would like for us to have a full day meeting just to hear voices. The audience are the people speaking, talking about what they need to do. And let me just say this, as someone who had the pleasure and honor of teaching both the First Lady and the President at Harvard Law School, it was a very important time for me as a law professor to think about what they meant. Michelle was the brightest person in the room. I mean, she was just absolutely exceptional, committed to public service work. She was a student lawyer for poor people in civil matters and housing and public assistance, all those things. And I was convinced that she was going to be the first African-American woman elected to the Senate. She went a different way, but she is talented. And some would say, and I'm not saying it, you didn't hear me say more talented than President Obama. I didn't say that. You didn't hear that from me. I know you're all blogging and tweeting. I did not say Michelle Obama is brighter than President Barack Obama. You did not hear that from me. Got it? All right, good, good. And Barack Obama was special and is special. Mentoring him as a student and then seeing his rise from the state Senate in Illinois to the United States Senate for the state of Illinois and then to the presidency is a sense of what we can do. And I want to give you the other part of Barack Obama and Michelle Robinson Obama. Michelle's mother and father made sure that her and her brother Craig could go to Princeton. And then she went on to Harvard Law School, although her parents couldn't afford it, right? It made a big difference. But the reality about it is that if you think about it, Barack Obama also, if you think about where he is today, people forget where he came from. He was born in Hawaii. He was born to a father from Kenya and a mother from Kansas, who happened to be white. Mother was pregnant as a teenager. He saw his father in his entire life one time. One time. If I ask you what happens to an African-American male born in 1961, father is absent, mother's pregnant as a teenager, where would they be 51 years later? You would say dead, in jail, or in prison. No, he's at 1600 Pennsylvania Avenue Northwest. And we still have work to do. And I think that's very important. We have to challenge and make sure that he does that work as we go forward as well. That's very important. And I hope that people in this panel will be honest about what we need to do and not just praise what we've done, because our work has just started. It's one thing to get somebody in the White House, but it's also important to make sure that our issues are there forever. And just as important as it is election 2012, 2014 is important, 2016 is important. And I think all that's part of what we're going to do. So for this 20-minute panel, Frank, I have 5 people, and 4 of them are here. I'm going to introduce all of them. Dr. Rodney Hood, if he'll come forward. He's a former president of the National Medical Association and president of the Multicultural Primary Care Medical of San Diego. Please welcome Dr. Rodney Hood. Mr. Fred Swan, who's a healthcare organization expert from Springfield, Massachusetts. His brother, Ben, is a senior Massachusetts State Representative. And if anyone, both Carl and Marcellus and other lawyers should know this, this is the brother involved in the Swan versus Mecklenburg case in the 1980s out of North Carolina. Still standing strong, and hopefully we'll hear something about that family. Please welcome Mr. Fred Swan. He takes institutional cases and has been very successful. Please welcome into the panel Attorney Marcellus McCrae. And our final panelist is Mr. Clifton Blevin Jr., who is a graduate of this university, University of Southern California, and has expertise in the area of financial management and financial affairs. Please welcome Clifton Blevin Jr. My first question was going to be for Dominique DePrima, but I'm going to ask it to Dr. Rodney Hood first. Just about the whole idea of the Affordable Health Care Act, what it means. A lot of people don't know. We know that it takes care of pre-existing illnesses. We know that you can bring someone in under 26 who lives with you that will be covered. We know it covers millions of people. What does the community need to know about the affordable health care that's been passed by the Supreme Court from your point of view as a doctor? How important is it, and what should we do about it?
Well, good morning. I'd like to start off by saying that, first of all, we talk about health. And I think the Affordable Care Act is very important to America, but mostly to our community. I tell my patients to look at your portfolio, your retirement, your house, and tell me what your number one asset is. And they always give me the wrong answer. Because your number one asset is your health. All of that other you cannot enjoy without your health. Why is health important to our community? Because we have the poorest health. One of my areas of expertise is what I call health disparities. Minorities, especially African Americans, have some of the worst health outcomes of any group. And what makes it personal to me is that the lowest life expectancy is with the African American male. That's personal. Why is that? Many reasons. Poor access, poor environment, poor quality. It is the Affordable Care Act, I believe, that will improve access to our community. Here in California, about 5 to 7 million people will now have access to health care that haven't had adequate access to health care. What is the importance of access? It is estimated that 37,000 individuals each year die because of lack of access to health care, just not having insurance. So it is critically important. And even before the Total Act is enacted in 2014, there are Californians who are transitioning into the Affordable Care Act. There's a pre-existing health plan that folks who had pre-existing conditions that was actually started in California last year. 10,000 Californians who couldn't get insurance now have insurance through that process. So it is important.
Great, thank you. We're joined by Dominique DePrima, and I just want to ask you, you were on the radio when I talked earlier this week, and one of the issues you said is messaging. So most people don't know what's in the Health Care Act. As a journalist and someone in the media, what do we need to do to make sure people understand what this act covers and what it means for us in the 21st century?
I think first we have to figure it out for ourselves, and then try to share that. I think for me, I know conceptually what the Affordable Health Care Act is. People with pre-existing conditions, can get insurance. Your children can stay on your insurance until they're 23, 26. Yeah, I wish we would have had that when my daughter was in college. We know a lot of basic things like that. We know there are more preventative services. we know a lot of the basics conceptually, but what I think I don't know, I'm going to say, I've tasked myself with doing this in the next couple of weeks, is specifically, how do you join a healthcare exchange here in California? Do we know this? We are the test case. We're the big test case. California, if we can make it work here, we can make it work, and we can help the president's model to work nationwide. So, but if we don't know, where do you go sign up? How do you get into a health care exchange? How do I benefit from that? You know, what are some of the services that are affordable, that are free, that are available right now? There are things available right now. We keep hearing, oh, it doesn't kick in until 2016, it doesn't kick in until, you know, the cows come home. Well, not true. There's preventative services for women available right now. If you're a low-income person that hasn't had insurance, there are services available right now. If you've got testing that needs to be done. So I think it's finding out where are the locations on the ground. How do we actually physically go and get into a healthcare exchange? If we sign up in droves, and we make it work, we create the model for the nation. Because I don't know if you're aware that California's been ahead of the curve. We've been proceeding as if affordable health care was constitutional before the Supreme Court weighed in, and we've been proceeding as if it didn't matter whether the president was reelected or not. We were going to proceed with the Affordable Health Care Act. So lucky for us, the president was reelected, and the Supreme Court, for once, did the right thing. So now we are already way out in front, and we have to be sure that we in the media can show people where to go to access those services in the numbers that we need to show up in.
Great, thank you very much. Let me ask my former student, Marcellus McCrae, this is the idea that this past year the Supreme Court, the conservative Supreme Court, passed the Affordable Health Care Act is tremendous. It's a very conservative court. It passed the immigration reform as well. But what does it mean in terms of people thinking about their legal rights? What does it mean now to have a national health care center? From your point of view as a lawyer, how important was that decision?
I think it's immensely important because, you know, one of the criticisms with respect to the disparities in terms of access to courts and people feeling like they're discriminated against in healthcare is that even though there are different statutes like the Medicare statutes and so forth, Title VI of the Civil Rights Act was really the primary vehicle to address what people felt were civil rights violations. And there are certain hurdles there with respect to proving, for example, intentional discrimination, etc. But the basic concept is that any institution that receives federal funds had to treat people equally regardless of protected classes like race or gender and so forth. So to have this national recognition with this conservative court, and hopefully it's a harbinger that it's a much more hospitable climate for people that feel that their rights are being denied or that they're the victims of discrimination to be able to have access to courts to bring these cases. What I'm also hoping is that it's a catalyst for some of the gaps in civil rights legislation so that you can specifically have civil rights legislation passed in the area of healthcare to address some of the historical gaps that the African American and other communities of color have been operating under really since this country's inception.
Let me just say one other thing that relates to that. There's been a lot of talk recently, particularly among conservatives, but it's a general conversation about, well, we are post-racial. We elected a black president. So now we need to re-examine the Civil Rights Movement, the Voting Rights Act of 1965. We don't need all those things. And even Title VI, why do we need that? We elected a black president. What's the answer to that view that's gaining some momentum that we have solved the race problem? Why do we need these specific laws?
I just think that is so sad and so utterly delusional. I mean, you know, and you knew that that was going to come, right? That as soon as there was an African American president, now you got what you want, and if you may not get another one for another 100 years or 500 years, but we're done. We're done with that discussion. We can move on and we can put that to bed. Unfortunately, I think people are able to compartmentalize the political realm, where you have obviously historic success in one person, and to extrapolate that means that you also have now equality in the economic realm, in the social realm, in the health realm, and all of the other realms where the ravages of historical discrimination and the accretion of disadvantages have been planted. Anybody who thinks that obviously is, as I said, delusional, and it is a gross injustice and gross oversimplification. So the response to that is for those people to actually go to a place where they have facts and to actually start reading statistics, the ones that the good doctor here was talking about in terms of, well, let's address, for example, when people want kidney transplants. Who's most likely to get that kidney transplant? Let's say when people go to get health care and they have to get options with respect to surgery. Do they get the same treatment with respect to that? Are they affected? And I'm not even talking about things of race. What about things that bisect race, like class? How about poor people of any color? Right? That's the much larger net. So to sit there and say you have Barack Obama, we're in a post-racial society, we can move on, it completely conflates, that's a good start with, this is the beginning of the analysis, not the end of it.
Thank you very much. I'm going to go back to Dr. Hood for just one question, which is really toward the solutions, and I'm going to go to Mr. Swan and also Mr. Blevin. What do we need to do? We keep talking about, national support, the idea of medical care, but what about prevention? And in this community, we have some of the most serious problems in terms of things that are treatable and preventable. And I know I like a lot of stuff that's not healthy for me. What's the message that you're trying to send to us about what we need to do ourselves to address the prevention issue, which has to be central?
Yeah, that's an excellent question, and I'm going to give you an unusual answer. And what that is, I don't believe there's anybody here in this room that is not aware that a healthy lifestyle will make them more healthy. There's nobody in this room that have not heard the messages about what's good for you and what's not good for you. Yet and still, many of us, to a greater degree, continue to live unhealthy lifestyles. So the question is why? The Affordable Care Act, nor any other good doctor or anybody, is going to make you healthy except yourself. And that means individual self and collective self. One of the reasons why I'm here is I have learned that as a physician, the power that I have to heal is very limited. In that it is really up to the community to mobilize. You have to make this Affordable Care Act work for you. Because just having access doesn't make you healthy. You are not treated the same within this health system. Subconsciously, the racism used to be overt, now it's subconscious. There are many studies out now that will tell you if an African American goes to X, Y, or Z, that physicians, usually not looking like you, will treat you differently and usually less differently. That's not me accusing them of anything. This is what the studies show. So you have to be aware that not only is the problem getting access, but once when you have access, getting quality within that access. You have to look at your community. And if you have too many fast food places, if you have too many liquor stores, if you have a bad environment, if you have poor food, you need to organize and advocate to have that change. Because nobody from Washington with the Affordable Care Act will do that. So it is individually, yes, stop smoking, drinking, you know what doctors tell you. But more importantly, you have to make your communities healthy. And that is a collective action. So I just got involved in a grant. And one of it is identifying patients who are at high risk. They're going to the hospital, going to the emergency room. And what we're finding out is that the reasons why they're sick have more to do with their environment and their poverty and lack of transportation, confused about their medications. If you get resources there, these people do much better. Finding out their environment, changing where they live, helping them to change where they live. So changing your community and your environment is probably number one. That makes it easier for you as an individual to change than to be able to get out and walk and jog, being around other folks who don't smoke or drink.
And let me just ask you one final question. I know this is coming from the audience. That, you know, I diet, I exercise, I do all those things, but I just can't understand why you're suggesting to me that there's something wrong, health wrong, morally wrong, with enjoying a slice of red velvet cake. Right? You know, it has all the ingredients and right? Tell me what's wrong with red velvet cake.
Well, it was good, the one I had yesterday. It was very good. Now, listen, we all have our red velvet cake every now and then, okay? And I tell my patients, don't come to me and lie about how good you've been, okay? It's really about being duly proportioned. It's not about just changing your diet. You have to change your lifestyle. And that begins with changing your mentality, having a reason to change. And I tell folks, the first thing you should do is start exercising. Because I don't know whether research bears this out, but people who exercise tend to eat healthier than people who don't.
Dr. Oguchi, can I just say something really quick, because this is like my personal mission. We do Wellness Wednesday, every Wednesday on the front page on KJLH. And I feel like we're always, every stat, we have the most diabetes, we have the most this, we have the most AIDS, we have the most breast cancer. But this is the one thing that I feel like we truly have the power to change, like tomorrow, without anybody's help, without a commission, a doctor, without a president. And I just, how many glasses of water has everyone had in here today? None? Yeah. Okay, so half your body weight in ounces minimum. So if you weigh 100 pounds, you need 50 ounces every day. And that's if it's not hot and you're not working out. I mean, these are simple things we can do. And one of the reasons that I love the Affordable Health Care Act is because it puts emphasis on prevention. Like, my whole thing is, I don't want you to only get paid if I'm sick. I need you to get paid for keeping me well. You know, and now we're seeing more of an emphasis on, you know, incentives for exercising, incentives for early checkups, incentives for keeping your weight at a certain level. And this is the key, because as long as the medical industry gets paid for us to be dying, it will be, I like what Dr. Relaford says. Dr. Bill Relaford says, if y'all hate to go to the doctor so much, how come y'all keep doing the things that make you have to come see me? So my philosophy is avoid the doctor. Nothing personal, doc, but that means, you know, even if you just walk around the block, drink your water, get your sleep, you know what I mean? Breathe. That's it.
That makes a big difference. I actually, I'm going to go to Mr. Swan just a second, had a panel in Jamaica last month, and a brother who works for an insurance business says, you know, this healthcare thing is problematic because we want people to get sick. That's what insurance companies are for. I mean, very candid, very honest about we need people to get sick in order to continue our business. And it was a wake-up call. It says, don't tell anybody I said that, so I'm not going to mention his name. But the reality was that's a clear sense that we fall into that sense. And if we walk outside this campus and go around Crenshaw and other places, we'll see liquor store, fast food. We see all the devices that make it a problem for us. Mr. Swan, I'm coming to Mr. Blevin. Swan, your sense about what we need to know about health and what we need to do that we've been ignoring.
Good morning. I'm happy to be here this morning. I'm happy for the rest of my panelists and for Mr. Jordan, who asked me to come in from North Carolina, by the way of Massachusetts, by the way of Mississippi, to get here this morning. I also want to acknowledge the mentor for our president, who's here with us this morning in the presence of Dr. Ogletree. In 1967, we had a vice president named Hubert H. Humphrey. Some of you who have gray hair like me remember him. We called him the happy warrior. He had a philosophy. He said that government's role is threefold. It's to take care of those who are at the dawn of life, the children, those who are in the shadows of life, the sick and the disabled, and those who are in the autumn of life, the elderly. He said that, and I thought about that when I've been listening to the Tea Party Republicans and their perceptions and their fight against what they label Obamacare, but we ended up liking that name. But in June and May of 2010, when President Obama signed the Patient Protection Affordable Care Act, listen to the name, Patient Protection Affordable Care Act. Don't forget the patient protection part. This law is a really big deal. It's important for all of us who have a leadership role in the community, whether it's the faith community, whether it's education, whether it's in community agencies. We have a responsibility to know what's in this law. On a serious side, we need to know what's in this law, because when you dig deeply in it, it has economic implications, it has job implications, current and emerging job that does not require professional education. And if you go back and look at those three areas that I talked about in regards to Hubert Humphrey, that's where the jobs are. And aging, those people who were born like I was in the 40s, or those people, myself and Frank Jordan, we were born at a time we were called the baby boomers. The baby boomers are coming of age. We are getting a little bald, we're getting a little gray, and one of the big moves in healthcare business nowadays is how do you take care of the baby boomers who have chronic illnesses, and all of us have those people in our family. All of the pastors have those in our parishioners. Now, the key thing here is that what we try to do now, we have something that I've been working on called Health in Place. We want to keep our older people in their homes and in their community and around their family. We have something that we put in place. My background, and I know I'm kind of belaboring this thing, Dr. Ogletree, but I'll be done in a minute. My background is in community health centers. I ran a community health center for 12 years, and I also ran a practice for 6 years. What I found is that community health centers, and you have them all around here. You have a primary care association for the state of California. You have a National Association of Community Health Centers. What their role is prevention. They began in 1965. And a lot of the new parts of the law is going to come into effect in 2014 in regards to the individual mandate and in terms of the expansion of Medicaid. Going to fall on those community health centers because they are the fail-safe organization. You need to know who they are. You need to play a leadership role there because 51% of their boards must be patients. That's how the community controls. They are owned and operated by the community through law. We are a nation of laws. In Massachusetts, where I've experienced most of my work in healthcare, we were the first state to have universal care. Romney told you that a lot of times. He didn't tell you the whole story, but he told you a lot of stuff about that. In Massachusetts, and when I did most of my work, we have two mandates that are statutory mandates for healthcare. That's the State Department of Public Health and the local health department. It's probably the same with you. So when we look at the legal implications of health, it's usually with the state and it's usually with your city health department. Now, how does that relate to the Affordable Care Act? Well, the Affordable Care Act is a codification of best practices. There is so much in that law that deals with preventive research. They have created institutions that does research in terms of best practices, looking at How do we examine the research out there? How do we define how to move based on developing programs based on those research? How do we look at whether the health exchanges are working? So going back to a couple of questions that Dr. Ogletree posed earlier, what do? What are our responsibilities? Individuals, we have an individual responsibility, an organizational responsibility, and a community responsibility. Most of you in this room are play leadership roles in one way or another. So the first thing is knowledge, information, understanding what it is, and understanding how we can leverage where the levers of power are and how to leverage them. Now, I'm going to pass this on because I know there'll be questions later on in terms of how one accesses, what are the eligibility requirements, and we have all that information. And if you Google Kaiser Family Foundation, there are an awful lot of information online. Kaiser Family Foundation is one. Minority Health, Office of Minority Health is two. National Association of Community Health Centers is 3. If you Google those, they love to tell you what's in that bill. And they will even give you a summary. Just print it out. And they will bring it down to your community. You'll bring it down to your doctors in your area. That's just how good they have gotten in this stuff. I mean, it is done very specifically. So with that, I'll pass and we'll come back to you.
Thank you very much. I was actually on the Kaiser Family Foundation board for 8 years, and I know how important it is. It's a nonpartisan organization, and I hope that we can think about this, Frank, in terms of getting people that information, getting access to it, because that's going to be very important. Mr. Blevin, let me ask you as well. You've talked a lot about the financial issues in terms of it. Is it affordable? How do we find it? How do we get it? What's your sense, and what do people need to hear about healthcare and health in the 21st century?
Well, there's been a sea change, as you mentioned. I used to work for a company that was on the side of, or in business of people being sick. We're talking about insurance companies. We're talking about companies, as Dr. Ogletree mentioned, whose very livelihood depends on us going to the hospital for care. Well, the sea change, as all of the panelists have mentioned, is the focus now on preventative medicine. And preventative activities that keep you out of the hospital. And one of the great opportunities and great accomplishments of this particular community, the Los Angeles community, is a recognition of how important this is, and the fact that the grassroots is actually the entity that's going to lead it. It's not going to be top down, it's going to be bottom up. And everyone here has a responsibility, first to themselves, then to their families, and then to their communities, their blocks, their neighborhoods. One of the things that corporations have realized in this sea change, the Affordable Health Care Act is passed, despite their best efforts, and so now it's law. One of the things that I've had the opportunity to do with many organizations is form coalitions that send mobile hospitals and mobile health care units to the communities. One of the issues that our communities have is the lack of, or the lack of healthcare facilities in communities. It's getting better, but we all know there are very few hospitals and very few organizations and facilities that are dedicated to our health. One of the things that we've done is bring corporate dollars to sponsoring these mobile hospitals and healthcare units to go into the community. It was already mentioned. The liquor stores are already in the community. The fast food restaurants are there. They're right there on every corner. These mobile health units need to be on every corner. The healthcare facilities that are dedicated to one thing, our health, need to be on every corner too. And so I'm excited about what I'm seeing in the corporate community about sponsoring these types of vehicles to bring health to the community.
Thank you very much. We're going to take a couple of questions because times are out. We've got the microphone in the back. We've got time for 2 questions. And I'm going to ask the folks to give us their websites if they will. This question right here, come down here. And you can talk to them perhaps beyond the panel because there are a lot of questions that need to be answered. And we can't always do it in the short time that we have. First question.
morning, everyone. Thank you so much for being here. My name is Courtney Johnson, and I'm a wellness coach, among other things. And you know, one of the questions I wanted to find out from that we can talk about today is how do we get people to, when it's time to grocery shop, reach for the right items? You know, I do workshops and I talk and I share and I'm in the community and I would say sometimes preach about when this runs out, it's what you're reaching for, which would help tremendously in keeping down the cost of having to go to doctors.
Great question. Want to respond?
Can we get some mobile organic food stores, some mobile vegetables? I have to drive all the way to Culver City to get organic vegetables. That's not right.
Any other? Dr. Spiller?
What Dominic says goes. I think you all know that. One of the great opportunities that I had years ago was to go on to the front page. And this is 10, 15 years ago. Carl Nelson, and one thing Carl didn't tell me though was I had to be there at 4:45 a.m. When I got over that, we were able to talk about how to make our communities more healthy. And it actually focused on youth. How do we get young people to focus more on health, to start to develop the right attitudes? And that started in school, getting better and more healthy choices for them in school, so that when they grew up and then went grocery shopping, they were already in the habit of grabbing the healthiest thing. As I already heard mentioned, the First Lady has led that effort to make healthy choices among our youth and everyone a priority in this country.
And I would say that it's threefold, because it's not just what you eat, but she's big on exercise, big on diet. All those things make a difference. And I know, I feel sad actually for young people, now that I'm well over 50. I'm not a young person anymore. But I remember we had physical education. It was required in school. You don't have it anymore. I mean, the papers are complaining about, students are complaining about healthy food. I just want a hot dog and some chips and a 16-ounce soda. I'm fine, right? The whole message is going out the wrong way in terms of what's healthy, and no one talks about that. But I think that's an excellent question, and I think we need to figure out a way to make sure that people understand it.
Just very quickly, Dr. Ogletree, one of the things that I've done with my health center is to work within the faith community, to have nutrition services after church or at certain times to reach those, and also, as has been previously said, to work with the schools. We put health centers in the schools. We had a youth health segment in our pediatric department, so that my goal was to have every single kid have their own doctor. Every kid should have their own doctor and have their own privacy based upon the law. And that's one way of getting people to do that. So get a nutritionist in the health center.
Dr. Hood?
Yeah, let me say this. I tell folks I'm a black man with issues before I became a physician. And so I'm not defensive about, because I talk about my colleagues probably worse than anybody on this panel. We have a sick care system rather than a health care system. And I'm not sure our institutions are going to change to give those messages. I think we need, the First Lady was doing gardens. We need to do our own community gardens. We need to get children involved so that they know what's healthy. For many of us, and I know it may sound negative, but I think it's too late. We're going to leave and still have that cake. So we have to start young, introducing the children to community gardens, farmers markets. We need to, if we see unhealthy things in the community, that's when we need to go and mobilize and get that change.
Excellent.
The setting is King Drew Hospital, a politician being installed in office. His statement to the audience was, people miss opportunity because it's disguised as work. He's paraphrasing another politician who was being installed who said, stop whining, stop complaining, put on your working shoes. marching shoes, take off your house shoes. This is what politicians are telling us, and think what you're saying. We have the obligation to do what we put politicians in office to do. Are we going to stop whining and start fighting and screaming and yelling? If that's the case, tell us how to commence with that activity.
Great, thank you. Okay. Anybody want to respond to the first question about advocating for visiting hospitals, and the second one about whether that should be faith communities, and also what we're going to do about these King Spalding hospitals as well? What do we need to do as a people as opposed to people we elected? Anyone want to take that?
Yes, very quickly on the first question. The faith-based community is an excellent place to start. We are, as a community, are very used to asking for things from corporations that we do business with. We ask them for all sorts of donations for our programs. One of the things we don't ask them for is for health-based care. In other words, rather than asking for money for an event, ask them for money for a mobile health care vehicle that will be at a certain time in a certain place, the church parking lot, the school parking lot, so that it can screen the citizens for various maladies. One of the most successful programs that I had the pleasure of taking part in was bringing out a mobile health vehicle right on Crenshaw to screen for prostate cancer and breast cancer. The lines were around the block, and that was sponsored by a faith-based organization. So we all have the power to do it. It's about changing our priorities and saying, we are going to dedicate some time to bringing the corporate dollars that are out there that we use for other things. We are going to dedicate it to this mobile, healthcare unit or mobile hospital to screen.
Mr. Swan?
Also, I would suggest keep in mind what's in that Patient Protection Affordable Care Act. The issue is quality. Hospitals and physicians are being penalized for dealing with quantity as opposed to quality. The law requires electronic medical records. It requires updated technology. There was a provision just this past year implemented for accountable care organizations. Accountable care organizations in terms of how to make healthcare more effective and efficient. The other thing is, as far as these health exchanges are concerned, the health exchanges, how they operate, how they are made operative, is they then identify what they call health navigators. Health navigators are organizations that are charged with outreach, going out and educating people, outreaching people to bring them in, get them signed up, and get them health care. Now keep this in mind, that the status that's in place and that will be expanded for that are community health centers and community hospitals. It is in their best interest and their benefit to get mobile units out there. So go toward where the pressure is and where people get paid off for doing the right thing.
Thank you. Thank all of our 5 panelists for their insightful comments. They'll still be around for a few minutes if you want to get some more questions. Thank you very much.